When I graduated from Vanderbilt, I had a vision or a dream to start a pain clinic that would meet all the patients' need under one roof. I felt that a lot of pain patients would come in, see a doctor, and be triaged off for physical therapy, for imaging, for procedures, and have to go to hospitals, and have to come back and go someplace for their therapy, have to go someplace for their imaging. So I felt pain patients really deserve to have an opportunity to have everything done under one roof. So that's what we've been able to do. We have a state-of-the-art surgery center which takes care of all the procedures that we do, anywhere from radio frequency ablations to epidural steroid injections, different kind of nerve blocks to try to figure out why somebody hurts, where does somebody hurt, how we can help develop the treatment plan a little bit further. We have a great imaging center. We have a world-class MRI. We have our own drug screening lab on site. So our message to the patients is, once you come here, you don't have to go all over town to get all the different services. You can actually get everything done at the pain management group. So I think that's really unique. It separates us from any other clinic that I'm aware of, and it really creates patient satisfaction and efficiency. What we found out that a lot of pain patients who come to the pain management group, not only do they have pain, but they also suffer from underlying depression. And quite frankly, at the time when we started the practice, we weren't really treating the mental health component, the behavioral health component. So we're very excited to say that now when a patient comes in, not only can we treat their pain, but if we recognize underlying depression or anxiety, we get the help that they need, and really it just makes for a better outcome for the patients.
Because I have a passion for mental health and for psychiatry, I don't think of the stigma, but it still does live, and people do have some fears about coming to see a mental health provider, especially in a medical practice or a pain practice. And often, for me, my approach is pretty conversational. You know, there's nothing really frightening about it. It is really assessing how you're coping with life, how you're coping with pain. What's the source of pain? How long have you been dealing with pain? What are your stressors? What are the supports that you have in your life? I mean, it really builds a big picture where we can put it all together and say, can we make this better? Not just with opiates, but can we treat maybe the mental health side? And there are many medicines that actually do multiple things. Maybe something I could give you that could treat depression might also decrease pain, or vice versa.
Also, in addition, we're very excited to have nutrition counseling on board. So we recognize that a patient who obviously is in pain, maybe a little bit depressed, we can treat some of the pain, we can treat some of the depression, but then came the weight. And that was another problem that we saw that just compounded the patient's pain problem. So now we have nutrition on board, which we can work out a diet plan designed to meet the needs of the patients. And we know that if we can help a patient lose weight, their self-esteem goes up, they feel better about themselves, but there's a lot less pressure and weight on the joints, the spine, and all the additional structures that they have to support. So the patients really like it, we're very excited about it, and we've had a lot of success with it.
Nutrition services at Pain Management Group, what a patient can expect is to come in, sit down with me. We're going to have a one-on-one conversation. It's going to last about 30 to 45 minutes. What we're really going to get into is we're going to get into that person's life. We're going to get into your diet, what you're currently eating, your lifestyle, what other things you have going on in your life. And then most importantly, we're going to get into what motivates you. So we'll be talking about everything from weight management, management of chronic diseases such as diabetes, heart disease, lowering your cholesterol. All of these things come together, and what we're going to do is we're going to create an individualized, personalized nutrition plan just for you. Because just like pain management, nutrition is not a one-size-fits-all. It's super specific to each individual person. So my job is to get to know each patient and then help you devise a plan that you can take home and implement into your daily life.
We recognize that there's a cultural bias against pain patients. Many times if you complain, you're seen as a whiner, you're seen as somebody that just complains, that maybe doesn't want to work, that just wants to go to a pain clinic and get put on narcotics. So we recognize the stigma associated with being in a pain clinic. And one of the things that we work very, very hard is giving somebody their dignity to diagnosis, meaning you're treated like a human being. We recognize the fact that you have a pain problem. We're here to help figure out why you have a pain problem. We don't treat you like a drug seeker. We don't treat you like a complainer. We don't treat you like somebody who just doesn't want to work. We really take care of you. We take care of the mental health part of it, we try to take care of the weight component of it, and then we take care of the pain component. And those three things together makes very happy patients. I think another thing that really makes the pain management group unique are the physicians. All of our doctors are anesthesiologists, which is really different from a lot of other pain clinics. Some pain clinics are run by primary care doctors. Some are run by a neurologist. Some are run by a physical medicine and rehab doctor. Many of them haven't even done a pain fellowship that's recognized by the American Board of Subspecialty. The other thing is we all get along great. We're all friends. We all like to take care of patients in a similar fashion. We really like doctors that connect with patients, that have good personalities, that relate to patients, that really want to help. And I think having physicians that really want to take care of pain patients makes a huge difference in a practice, and that's another reason why I think we have great patient satisfaction.